Hi, I'm Liz, an education and mental health professional. I'm often asked whether there's a test for AuDHD. And as someone who's spent years working in mental health, education, and neurodiversity, I know how important it is for people to understand their own brain wiring. It's really, really helpful. So, AuDHD isn't a clinical diagnosis. It's an informal term that people use to describe having both autistic traits and ADHD traits. Many people find it's helpful for self understanding, but it's not something a doctor officially diagnoses as ADHD. So, this video is simply an awareness tool, not a diagnostic test. If you have concerns, always speak to a qualified healthcare professional. And before we start, if you enjoy content like this and you want to support the channel, please hit the subscribe button. It really does help. So the unofficial AuDHD self-reflection test for 2026. Grab a pen and paper. You'll rate each question from 0 to 4. So 0 is never, 1 rarely, 2 sometimes, 3 often, 4 very often. So here we go. 15 updated questions for 2026. Do you start tasks with motivation but struggle to finish them? Mark that out of 4. Do sensory experiences like noise, lighting, or textures overwhelm you? Again, mark out of 4. Do social cues or facial expressions feel difficult to interpret? Do you feel the need to fidget, move, or stim to stay regulated? Do you become deeply focused on interests or hobbies for very long periods? So for very long periods, I'd be thinking you would skip meals or skip rest to do these interests. Okay, so mark out of 4, and let's carry on. Do you easily get distracted by your surroundings or your own thoughts? Do unexpected changes or disruptions make you stressed or unsettled? Do you find organizing tasks, planning, or managing time challenging? Do you use stimming or repetitive movements to cope with excitement or stress? Do you act or make decisions impulsively? Do you find it hard to read tone of voice or subtle emotional signals? Do you struggle to shift from one task or activity to another? Do you often forget appointments, deadlines, important tasks as well? Do you feel especially sensitive to criticism, rejection, or perceived disapproval of yourself? Do you mask or hide parts of yourself to fit in socially or avoid judgment? So, take a moment to add up all of the numbers in your score and we'll work on interpreting them. You might want to pause the video now while you do that and press play again for your results. Remember, this isn't a diagnosis, it's simply a reflection exercise. So, if you got 0 to 29 points, you may not relate strongly to many ADHD associated traits. But if you're still concerned about your experience, obviously consider speaking with a healthcare professional as soon as you can. Everyone's neuroprofile is unique. If you got 30 to 60 points, you may recognize several traits often discussed in both autism and ADHD communities. And if these experiences are impacting your daily life, it might be helpful to speak to a professional to get an assessment or some support. No matter your score, here's what I always remind people. You are valuable, valid, and not defined by a checklist or a label. Understanding your brain is a tool for you, not a label. It's to help you to navigate the world more confidently. If you found this video helpful, please give it a thumbs up and share it with someone who might benefit. And feel free to share your experiences or questions in the comments below. I'd love to hear from you. And thanks so much for watching. Take care, and I'll see you in the next video.